Epigenetics for Female Personalised Cancer Care, or EpiFemCare, is a collaborative research project aiming to introduce more effective screening, diagnosis and personalised care for women with breast and ovarian cancers. The project will be conducted in 3 main phases. In Phase 1, we will compare samples from patients and healthy volunteers to identify patterns of DNA methylation uniquely associated with breast and ovarian cancers. This will be achieved using 2 different approaches. Approach 1 examines the actual cancer tissue and compares this to normal tissue, including white blood cells, using a specialised bead chip. Approach 2 will be developed by GATC biotech scientists and involves analysis of cell-free DNA directly in serum using a sequencing approach. Before methylation patterns can be scrutinised, the DNA must first be treated with a chemical called bisulfite to resolve the methylation signal. Both approaches will identify patterns of DNA methylation unique to cancer. All of the data will then be interrogated by specialist software developed at Gene Data to find the most informative DNA methylation signatures. In Phase 2, the consortium will test the most promising cancer markers and develop a method that can be easily translated into clinical practice. Again, 2 different approaches will be explored: direct bisulfite sequencing and PCR-based digital methylite. Their performance will be compared and one method chosen. To make this possible, successful patient recruitment is vital. Women with breast and ovarian cancer treated at the 3 collaborating clinical centres in London, Prague and Munich will be asked to provide blood samples. Phase 3 will involve validation of the test using blood collected as part of 2 important clinical trials. To address clinical diagnostic utility, we will test serum samples collected as part of the UCL UK CTOX trial that recruited more than 200,000 women between 2001 and 2005. Serum samples are available that were drawn from women before they were clinically diagnosed with breast or ovarian cancer and will allow us to see if the test can detect early disease. To address the test's value in informing individual treatment strategies, we'll look at samples from the Success breast cancer treatment trial, run by Ludwig Maximilians University in Munich, which recruited more than 3,700 women between 2005 and 2007. There is no similar cancer treatment trial available for ovarian cancer, so we'll use samples prospectively collected from women attending UCLH and Charles University Hospital for ovarian cancer treatment during the first 2 years of the EpiFemCare project. We hope to change the pathway of care for women with breast and ovarian cancers. In the future, we aim to be able to diagnose breast and ovarian cancers at least 1.5 years ahead of current practice, improving patient survival. The EpiFemCare project is partially funded by the European Commission's Framework Programme 7. For more information, please visit our website.